Hello there, I'm Wilky Mae and I'm going to show to you the autobiography of the Sulfonylureas Drugs Second Generation. This includes glimipiride, glipizide, and glyburide. So, what are we waiting for? Let's start.
Hi, I'm glimipiride.
And I'm glipizide.
Well, I'm glyburide.
So we are the
Sulfonylureas
Sulfonylureas Drugs Second Generation.
Our brand names are Amaryl, Glucotrol, Diabeta, and Micronase.
My chemical name? It's hard to mention. Just look at this.
Yeah, as well as my chemical name.
Mine too. But for things to be easy, just call us with our generic name.
We belong to anti-diabetic agents drug classification with an FDA pregnancy category C.
We are indicated as an adjunct to diet and exercise for type 2 diabetes management with metformin or insulin for diabetic patient stabilization. Our mechanism of action is we stimulate the insulin release from functioning pancreatic beta cells, which results in the increase of plasma concentrations of insulin. We bind to pancreatic cell potassium channels and can enhance the binding of insulin to insulin receptor sites or increase the number of insulin receptor sites. It is also recognized that we enhance the effect of antidiuretic hormones in the renal cells.
We can enter your body through oral administration with an onset of 1 hour, a duration of 24 hours, and a half-life of 4 hours. These are completely and rapidly absorbed from GI tract and then undergoes hepatic metabolism. Also, we are highly bound to proteins in plasma and also excreted in the bile and urine.
We are contraindicated for the use to patients with hypersensitivity to sulfonylureas, also in people with type 1 diabetes because of the absence of functional beta cells in which they could not benefit from the drug, and to pregnant and lactating mother.
It is important for you to know what is our side and adverse effects like erythroderma and photosensitivity for integumentary system, risk for acute myocardial infarction and stroke for circulatory or cardiovascular system, GI distress for digestive system, hypoglycemia for endocrine system, and headache, dizziness, and paresthesias for nervous system. So you should be aware of these effects and report immediately to the physician or to the authorities if it is worsened.
For the nurses, these are your nursing considerations before, during, and after administration to your patient. So first, before administration, you should conduct assessment, history taking, and physical examination. Also, evaluate the cautions and contraindications in order to avoid any unfair complications. Then, during administration, to assess the potency of the medication and the dose being used, monitor urinary or serum glucose levels regularly. Arrange to establish a weight reduction regimen and nutritional management for consultation with a dietitian. Arrange for comprehensive diabetic teaching program involving illness, nutrition management, exercise, hypoglycemia and hyperglycemia signs and symptoms, infection prevention, and hygiene. Then transfer during times of high tension to insulin therapy, for example, infections, surgery, and trauma. If severe hypoglycemia occurs as a result of overdose, use IV glucose. And lastly, after administration, you should track the patient's response to the drug, monitor the adverse effects, test the patient's awareness of drug therapy by asking patient to name the medication, its indication, and side effects to look out. And lastly, monitor the well-being and patient compliance to the drug therapy.
For us, glipizide and glyburide We have the same nursing considerations with glimipiride, but we have specific nursing considerations during administration, like administer as 30 minutes before breakfast, then divide the dosage and take it before meals if severe GI upset happens or more than 15 milligrams per day is needed.
Yay! We're done! So this is glimipiride.
And this is glyburide.
And this is glipizide that says no was better for safer administration.